Good afternoon, and thank you all for being here, and especially thank these young future Aggies for being here. Appreciate that. At the last stop, there were some youngsters just like this, and Brett Giroir asked for questions at the end of the press conference. The first 4 questions came from them, not from the audience. Thank you all for being here. We have some special guests that we'd like to introduce. First of all, Representative Terry Canales. Terry, we appreciate you making the trouble to come all the way down here.
It's not working.
What?
Yeah, we need to check the mic.
And then we're going to turn this on.
I hear it now. Now we got it.
Now it's better. Did everybody hear me introduce Terry Canales? Terry, thank you. We also have staff members from Congressman Hinojosa's office and Henry Cuellar's office. Thank you for being here. Staff members from Oscar Longoria's office. Joining us from the city of McAllen, Councilman Commissioner Trey Pebley. Trey, thank you for being here. Charles Amos, the PUB Commissioner. Charles, thanks for being here. McAllen ISD Superintendent James Ponce, and Board Trustee Hilda DeSajo. Hilda, thank you for being here. Thank you all for being here. We, about 2 years ago, one of the man at the time who was president of the Texas Medical Center in Houston, a guy named Dick Winerdy, an Aggie, and I were talking, and he had this idea. He said, look, we need to figure out a way to deliver great research in our medical centers directly to families without going through pharmaceutical companies, without even going through hospitals who have to. What we want to do is make sure that we get information to families about health care. And our goal would be to try to prevent people from going to the hospital to begin with. So we started thinking about it, and one of the things that we have as an asset at Texas A&M that no one else in Texas has, only land-grant universities in the United States have this, is that on any given night in Hidalgo County, for instance, you may have 300 farmers and ranchers meeting with staff members of AgriLife Extension Service. That Extension Service has offices in 250 of 254 counties, so the infrastructure is already there. And they meet with those folks for the purpose of showing them how to grow better crops, healthier crops, how to grow better cattle, healthier cattle, how to do all of those things with livestock and cattle. And basically they take the research, the world-class research at A&M, and they transfer it directly to the farmers and ranchers. And it occurred to us, why can't we use that same infrastructure and transfer that to the families of the state of Texas? In other words, imagine, if you will, on any given night in Hidalgo County, a group of farmers and ranchers meeting, 200 or 300 farmers and ranchers meeting with extension agents, telling them how to grow better cattle or whatever. And on the same night, in a different part of the county, people from the A&M Health Science Center are meeting with 300 mothers, teaching them the research that comes out on how to grow healthier children. And to try to short circuit that trip to the hospital on diabetes, or that trip to the hospital on asthma and infectious diseases, those things that are preventable. And so we began working on that process. Then all of a sudden a little magic happened. Brett Giroir, who I will introduce in a minute, who is the head of our Health Science Center and a pediatrician, and Chuy Hinojosa got together and started saying, look, we can do this because we've got all of these assets, all of these offices, all of these people out in 254 counties in the state of Texas. Let's use them in conjunction with the Health Science Center, and let's prevent people from even going to the hospital to begin with. Let's show a family how they can prevent diabetes if they're susceptible to it. Let's teach a family how to eat properly, just as we teach those farmers and ranchers to do the same thing. In other words, instead of using AgriLife research for the purpose of farms and ranches, we use the A&M Dental School, the A&M Medical School, the A&M Pharmacy School, the School of Public Health, and the School of Nursing, and all of the assets that we have there in that research that we have in the medical center in Houston through our RBT research facility, and we take that directly to the families of Texas. And so Brett and Chuy started working on, we looked at Corpus, we looked at some instances, and what we're announcing today is the beginning of something we call the Texas Health Initiative. What this really is the beginning of is the pilot project. The pilot project is 26 counties running from Cameron to Victoria along the coastal bend, where the incidence of diabetes is high and many of the things that we're talking about, and using that as a pilot project. What Brett will tell you today is that we believe, and we're absolutely committed to reducing the incidence of those diseases and the expenditure of those diseases by 25% by the year 2025. If you do that, the expenditure will be $7.5 million a year to do this. If you do that, the 10-year benefit to the state of Texas, not to mention the families, is $2.5 billion in money that's not spent. I believe that before this is over with, we will teach the rest of the country to use their land-grant institutions to take preventive care directly to the families of the state of Texas, and not only do great things for those families, but do great things for the Texas budget as well, because the #1 driver of the Texas budget is Medicaid costs, money that can be used for other things if we can figure out how to do this. And so with me today, I'll introduce Dr. Giroir, and I'll introduce Senator Hinojosa, who of course needs no introduction here. But first person I'd like to introduce is Dr. Jorge Venegas. Dr. Venegas is the Dean of Architecture at A&M. In case you don't know, Dr. Venegas runs 42 community centers in colonias that stretch all the way from El Paso down to here. It's not your granddaddy's architecture anymore. It's about how to live, not necessarily what to live in. And he has some great experiences and assets to bring to that. We also have, let's see, who else? What am I thinking here? I just went blank. Oh, Susan Balabina. Susan Balabina is the Vice Chancellor for Agriculture in the Texas A&M System. And Susan is in charge of the Extension Service. So it is Susan's assets that are in 254 counties in the state of Texas that will be used, that the legislature will not have to spend money on in order to effectuate all of this coming into to these 26 counties as a pilot project. First, I'd like to introduce Chuy Hinojosa. Without Chuy, this would not have happened. He lent the support. He gave us the encouragement. He and Dr. Giroir working closely together to make it happen. And so we're very appreciative for this idea flowing up, and we think it is going to be something that is copied around the United States. It is so unique and so powerful a way to deliver health care. Senator Hinojosa.
Thank you. Well, actually, Chancellor Sharp, you said my speech. But really, first of all, I want to thank Chancellor John Sharp and the A&M system for always being there for us here in South Texas, in the state of Texas. And for us, I'm very excited about this project because if we're to continue success in the future of Texas depends on our children. And in order for our children to be successful, they need a very basic, solid education, but they also need good health. And for me, this initiative is the type of initiative that will have a great impact, not only here in South Texas, but the state of Texas. And it is a project that will start for the first 2 years here in South Texas, the 26 county area. And when I was thinking about this project, what's amazing is, as you all know, education, our universities, always provide a better quality of life for our students, our families, our communities, because they educate us, they do research, they provide education in medical schools, dental schools, and nursing schools, to just name a few. But what is unique about this, people sometimes don't know that A&M has AgriLife, extension services. AgriLife, I first found out about them back in the 80s. And they had promotoras, they had people that go out to the communities and meet with families and educate families about healthy, nutritious eating, about healthy habits, about how to cook the right foods, how to sustain their own family. So when you combine that AgriLife and their credibility that they have and the presence that they have with the Health Science Center, the medical school, and they have all type of campuses here in South Texas, from the McAllen Public School of Rural Health to the pharmacy school in Kingsville to the Health Science Center, Education Center in Corpus Christi. You combine all those resources, you combine all that knowledge, and integrate, getting all the resources together to maximize education, to maximize wellness. And to me, this was so exciting about this pilot program. They will serve as a model, and it will integrate working with local doctors, healthcare providers, with the hospital systems and the managed healthcare systems to lower the cost of healthcare, lower the cost of Medicaid, but also more important, reduce diabetes, reduce infectious diseases, and reduce asthma. And the focus is on those three diseases. And we feel very confident that we can quantify the reduction in those diseases by 2025. And once we prove how successful it can be here in South Texas, in the 26 county area, then we'll move to the rest of the state and be able to show that we can provide a much healthier environment, not only for South Texas, but for the whole state. And this will serve as a model for the whole state. And for us here in the Valley, we want to thank again Chancellor John Sharp and the Aggies, because we're going to show how we can improve health care for all of Texas. Thank you.
Thank you, Senator. And then once this pilot project proves exactly that, that's when it goes statewide. And let me say also, we are not here because we want some of you to come to Texas A&M. We want all of you to come to Texas A&M. Every one of you. We have dorm rooms waiting for you. When we first came up with this idea, we didn't exactly have the right staff in place that had the enthusiasm and the knowledge to get it done. Now we do. Once Brett Giroir came on board, he got it. He's a pediatrician. You may also remember that A&M got this huge grant from the federal government to provide vaccines. Once a pandemic hits, he will be the person that develops the vaccine to save your life. So by coming here today, you automatically qualified for a vaccine when that time comes. But he is absolutely brilliant, and he is someone that when he makes a pledge, he keeps it. He doesn't speak idly, and when he tells you that he will cut the Medicaid costs or the cost of health care by 25% in a 10-year period of time, he will do that. Ladies and gentlemen, Dr. Brett Giroir.
Thank you, Chancellor. Thank you, Senator Hinojosa. I am a pediatrician, and there's nothing more exciting to me than to work on programs that can prevent illness and improve the health of our children and therefore our communities. And the key to improving adults' lives, I think, is by improving the health of their children. So I'm very, very excited to be here with all these colleagues. And we're here really to commit to you today, not to do something small, but to do something large. And we're committing because we think we could really do it. And that commitment is to reduce preventable disease in a 26-county region of South Texas by 25% by the year 2025. Now, that's a very audacious goal, but it's one that needs to be set to show that we're really serious about the problems. And with all of us working together with all of our resources, I think we can actually achieve that. It is our moonshot program, but it's one that we know we can achieve. We're focusing on 3 conditions. First is diabetes and obesity, that spectrum. We know how important that is to our health. In many counties in South Texas, over 40% of the population would qualify as having obesity, and as many as 20% having diabetes. And if this goes untreated or unprevented, it could have terrible consequences to your health. loss of limbs, loss of eyesight, premature death, loss of quality of life for you and your family. Asthma and other disorders, very important to me as a pediatrician. How many children lose days of school and their parents lose days of work because of asthma and related respiratory disorders? A great amount of that can be prevented with the right type of education. And new infectious diseases. We have new parasites in Texas, new hemorrhagic fevers like dengue fever that are just coming on us. And although they're not a dramatic threat right now, they will be a growing threat. And we're going to work on these 3 areas of condition. The thing that excites me more than anything is that we don't have to invent all new rocket science to solve these problems. The tools and technologies for improving the health of our communities, we know what they are. We do. But it takes an organization with the commitment and the capabilities of the A&M system working closely with all our regional and community partners to actually make that happen. I represent the Health Science Center. So what do we bring? We bring a medical college, College of Nursing, College of Pharmacy that's right in Kingsville and has residency programs here. College of School of Public Health, very, very important, in a College of Dentistry that will all be working on this problem. I think you all know as well, where's Olga Gabriel? Olga? Olga, who runs our South Texas campus right here in McAllen. Very, very important. They've done an incredible job with pilot programs, and particularly with new programs to train people in public health. Independent of this program, we're going to expand that. Our Coastal Bend Health Education Center takes care of well over 1,300 of the most difficult diabetics referred in by physicians all through the Nueces County. They do tremendous work, and we now understand that if we could just scale that program to 26 counties, it would have an immense benefit on health and save over $100 million a year based on the data we have now, $100 million a year in healthcare costs for this region. So those are tremendous kinds of numbers. We know how to do this. But the key to this is not anything to do with physicians or nurses. We all think we're really important, and that's nice, but the key is really to build on what we have that no one else can bring in, and that is an agency like AgriLife Extension. What they have done, changing the lives of communities and providing information that sticks. We all know what that means. You could learn something today and lose it tomorrow, but by being in the community, working persistently, they have incredible trust. If we combine our forces with the Health Science Center in all our efforts with an agency like AgriLife that can not only teach what to do, but help people grow their own foods in food deserts, do all the kinds of things that we need. But we'll go even further with Dr. Vanegas. We can go one patient at a time now, but he can design and has been designing communities that build in healthy lifestyles in the very fabric of that community to provide opportunities for playgrounds and walking trails and clean water and other services that are incredibly important. So these are the kind of partnerships that we really want to have. We'll also bring our vaccine center. As Chancellor Sharp said, we are responsible for providing the first 50 million doses of vaccines if there were another pandemic of influenza. All that capability is right at the A&M Health Science Center. We will bring that federal, national capability to make vaccines and new therapeutics into this project completely. Of incredible importance, finally, is that we have to and we will collaborate with all the regional partners who share this vision. You are very fortunate in this county to have a tremendous hospital system that already has a number of world-class programs specifically targeting diabetes care and related care. Just think what that will do joined with a public health workforce and agriculture workforce and all the workforces that we bring that could prevent these conditions from ever needing that hospital care. Not to mention all the counties around who don't benefit from that. We'll also partner with the Medicaid managed care companies who are very important because they have a philosophical and a financial interest in solving these problems. So we need everybody on board. This is a very comprehensive effort. It will start on a patient-by-patient basis. We expect to triple or quadruple the number of people we serve over the next year and a half, and it will have a long-term aspect as well, to change communities and families' behavior, to change their infrastructure, to build their capabilities from within, and to demonstrate how this can scale to the rest of the state and the rest of the country. So we will be working with all of you. If you're a teacher, if you're in the media, if you have children, if you know people who are involved in healthcare, we want everybody on this team. And we are, of course, looking forward to partnering with our brethren in the University of Texas System when they build a medical school. This is a problem that is big beyond any borders of maroon and orange. It's a problem that we all have to face together. But the key to facing that is harnessing the land-grant mission and all the great opportunities we have that no one else has because of agriculture, because of engineering, because of architecture, all working together. So I thank you all. We look forward to working with everybody in this community. Olga is a force of nature. We look forward to supporting her and her programs, to building the educational programs and the service programs here. Thank you for being here, and we would be very happy to answer any questions or entertain any comments from the group, from the public, or anybody in the media. Thank you very much.